The 3 long-term care facilities in the city are aging, and the government has said work needs to be done to address the situation. In February of 2009, the Ministry of Health gave the Cypress Health Region a $450,000 grant to design the new facility. And now that the initial layout is complete, the region is waiting for more direction.
We're finished sort of our part of it at this point, and we're waiting now to see what the priority will be when new funding comes available for capital projects.
When the new hospital was built, the city funded 35% of this cost. The new long-term care facility, which may be attached to the hospital, will also require city funding.
Nothing's been decided for the long-term care in terms of the city's share of the funding. That hasn't been defined yet, as the project hasn't been defined in terms of what it is going to be, I'll say, as a whole, and what portion of that would be the city's portion or a portion of that in terms of funding.
Both the city and health regions say they're waiting for funding decisions, and this is something the government also reflects.
They're waiting for planning money. I mean, it wasn't in this last budget, and we have another budget cycle underway currently, which will be brought down in a matter of months. So that's where we would have an announcement if there's going to be one. It would be in the next budget.
With the tight budget from last year, are you optimistic that money will be in the 2011?
Yes.
With this being said, the health budget in 2010 did not provide enough funding to cover the cost of inflation, and the Cypress Health Region had to compensate for a $1 million deficit. The 2011 budget will be passed this coming March and will provide concrete answers regarding the proposed long-term care facility in Swift Current. For Southwest TV News, I'm Kara Rapke.